Hi, everyone. I'm Dr. Gretchen Roth, a board certified dermatologist at the Medical College of Wisconsin in Milwaukee, Wisconsin. Today, I'm going to discuss how to treat HS in the emergency room or urgent care. We're going to do this with 3 questions in under 5 minutes. This education is brought to you by the HS Foundation. Part of the foundation's mission is to help educate all providers about proper diagnosis and treatment of HS. Okay, question number 1. Someone comes in with an abscess. How do I know it's actually HS? This is a really important question because about 1 out of 100 people have HS. So a lot of abscesses that are going to walk through your door are not actually infectious. They might be HS. So there's actually a really simple screening question that can help you determine if someone has HS or not. So 1, have you had more than one of these boils, abscesses, lesions, whatever you want to call it, in the last 6 months in a typical location like armpits, groin, buttock, back of neck, under breasts? And if they answer yes to these, more than 1 in 6 months and in typical locations, chances are very good that they actually have HS. Okay, well, now that I know that, what do I actually do? So someone's coming into your emergency room or your urgent care with a potential flare of HS. What can you actually do about it? So 1, the tried and true incision and drainage. Incision and drainage can be great pain relief for patients, especially with a fluctuant abscess. These are super, super painful for patients. So it's extremely important to actually numb up the abscess before you drain it. It is possible. Use lidocaine, go slow. These are horrifically painful for patients. Go ahead and drain and then do not pack. There's no reason to pack. Data shows that it's really not helpful in preventing recurrence, and it often just causes a lot of painful aftercare for patients. Second option is antibiotics. I often see patients get short courses of antibiotics when they go to the ER or urgent care. But keep in mind, it might be a while before that patient can get in to see their dermatologist or their primary care. And often with HS, we'll treat with longer courses of antibiotics. So go ahead and start a 3-month course of doxycycline, 100 milligrams twice a day, or clindamycin, 300 milligrams twice a day. Either of those are great longer-term options to help get them through to see their next person. A few days of prednisone is also a great option, especially for people with more widespread flares. You can use your judgment, but 40 to 60 milligrams daily for just a few days is often enough just to help take the edge off for people, and sometimes helps avoid the need for things like pain medications. And then if you have access to it, intralesional triamcinolone is actually an amazing option that may help avoid an incision and drainage altogether. So either 10 milligrams per mil or 40 milligrams per mil, whatever you have available. Use a small gauge needle, a 30 if you have it, and just a couple of tenths of a milliliter in each of the lesions is typically all that's needed. And patients will tend to feel relief over the next couple of days. All right, so you've got them all teed up. You're about to discharge. My final question is, why should I take 10 extra seconds to put in a referral? Patients with HS are historically often bumped around, cared for from flare to flare. Often they're getting a lot of their care in the emergency room or ERs. They may not have a diagnosis, they may not be aware, and you may not be aware that there's actually great long-term treatments out there. There's a lot of long-term effective maintenance treatments that can help reduce flares, reduce hospitalizations, reduce ER visits. In many places, this is going to be finding a dermatologist. So go ahead and put in a referral to dermatology. You know your area better than me. If you don't have any dermatologists around who are used to prescribing biologics, things like that. Sometimes rheumatology is the right way to go. And in some places, surgeons will do some of the systemic care as well. So place the referral, get patients to the right place, and also just take 5 seconds to remind the patient or to let them know if they're not aware that long-term treatments exist. And it's really important to get them plugged in with someone who can take care of them. Well, thanks so much for joining us today. I hope you learned a lot.